Yeah, so the problem with preferred pharmacy networks is that a lot of times the pharmacy is the last one to find out.
It's creating a lot of unrest, and the customers will call and say, how come you're not in the network? What can I do? It's not fair to them to tell them to go to certain pharmacies when they want to come to us.
To say that you have to use a big box or a mailbox is not anywhere close to equivalent to the kind of patient care that they're getting at my pharmacy.
The effect it has on them is that it fractions their care. They still think of me as their pharmacist, but they no longer can utilize my practice to provide their prescriptions.
I think in the current market where patients are sometimes being forced to use multiple providers and multiple pharmacies based on their network preferences is really dangerous.
So if we happen to be one that was not allowed to participate, even though we were willing and able, but we were not allowed to participate, then there's a void that happens in our community, and that's that face-to-face, that interaction that happens with someone who knows their history, knows their family's history, and knows where there may be gaps in their care and how we can follow through and help prevent those gaps and start closing some gaps.
And it presents a challenge because we're in a small rural community in Western New York, and patients rely on and need our services, and by excluding us from their network, it forces them to travel some distance to be able to obtain service, if at all.
Preferred pharmacy drug plans are kind of problematic in an urban area as well as rural areas because in an urban area we don't have a lot of big box stores that are nearby. Patients are having to travel many miles to get prescriptions that they would have been able to get in their local neighborhood. So not only is it bad health care, it's bad environmental policy. And
So, we provide delivery service all over the city. And there's a lot of patients who've been coming to us for 20 years that they've never come to the pharmacy because they can't get to the pharmacy in a practical way.